Now, a lot of people have been talking about Bernie Sanders' single-payer plan, saying, oh my God, it's going to cost us so much money. Politico had a huge article about the trillions of dollars that it's going to cost taxpayers. Well, the part they never tell you about is the money it saves us. It's so one-sided, it's comical. So I want to simplify things here and break it down so you guys understand what the single-payer system actually does. So right now, we have about $20 trillion in healthcare costs in the country that already exists. And it's broken down to about $15 trillion that you pay through your insurance and $5 trillion that you pay in copays, that's direct payments to medical providers, hospitals, doctors, etc. So that's, as things stand now, the country overall spends $20 trillion on healthcare. All right, now let's see what would happen under single payer. Well, right now we have $6 trillion that we pay as insurance costs and profits. So we pay that to the insurance company. The insurance company has all of its costs, bureaucratic costs, employee costs, and their profits, and then they pay the medical providers. Well, under single payer, we cut out that process entirely and save $6 trillion. Now, that's a pretty good start. Okay, now, there's something else in the current system that happens. We have $3.1 trillion in tax subsidies to employers so that the employers can then give you insurance that a lot of us have through our businesses, right? Well, under single payer, you wouldn't have to do that because you don't have to get insurance through your employer anymore. So we can get rid of that $3 trillion subsidy that now goes to the employers. So, but now the government is footing the bill. So what's left over? $11 trillion. And everyone, including Sanders' campaign, acknowledges the government under single payer would then have to pay $11 trillion. Okay, so that's where people go, oh my God, that's so much money. Look at all that $11 trillion that the government's paying. Okay, and then they say, how are you going to pay for it? You can't pay for it. Well, that's not true. And they say, oh, he never pays for it. No, he has a plan. It's very, very clear. He's got it outlined. He says, I'm going to increase payroll tax by 6.2%. Now, that affects everybody. So it's true. Your middle class would get a tax increase. And then he's going to do another income surtax for people making above $28,000. That's 2.2%. That affects most of us. So your taxes are going to go up by 8.4% to pay for $11 trillion of government spending. So that's a lot. That's true, right? And then there's a third bracket, which mainly affects the rich. And this is how a lot of it gets paid for as well. So he raises 4 brackets above $250,000. So people making more than $250,000, they're going to have their taxes increased in increments all the way up to 52% tax rate for people making above $10 million. So I want you to understand that it's not that if you make $10 million, they retroactively make you pay 52% on the rest of your money. No, it's 52% on every dollar above $10 million, okay? So all those brackets get increased by a little bit. Yes, you do pay 8.4% more in taxes. So this is the part that the media tells you about all the time. From you goes out $11 trillion to the government so that the government can provide single-payer health insurance. But here's the part they don't tell you about. We saved $20 trillion in healthcare costs that we had today. Now, you don't save the whole $20 trillion, you save the difference. That's $9 trillion. Now, some critics say, no, that's not fair. I think we'd only save $5 trillion. Oh, really? Only? Okay, so, and it's over a 10-year period. In a decade, we would save, as a country, on healthcare costs, anywhere between $5 to $9 trillion. You could make arguments against the system. You can say, hey, listen, I think it might be inefficient. It might not be the best way to pay for medical expenses. Is it going to provide the right incentives for doctors, hospitals, et cetera? And those are all fair arguments. But when you hear someone saying, oh, he's going to increase your taxes by so much money, understand that is highly deceptive, because instead of paying out that $20 trillion, we all do right now. We paid in copays, we paid in insurance costs, the employers paid. All this money that goes out to healthcare, instead of it being $20 trillion, it's going to be $11 trillion. you're going to save a tremendous amount of money. Yes, you pay a little bit more in taxes, but you don't have to pay anything for insurance. So now if you say, oh, well, my employer pays for insurance, so I don't pay that much anyway. No. And he lowers your salary. That's how it works. There's a certain amount of money that your employer can afford to pay you, but he has to take out what it's going to cost them in insurance, health insurance. If that doesn't happen, then you make that money. That's just the laws of supply and demand. So your salaries would go up by thousands of dollars on average. They never tell you that part. So understand the full picture. If you still don't like the system for legitimate reasons and other reasons, that's fine. But don't let them lie to you. Single payer does save us a ton of money, trillions of dollars.